Let's talk about heart biopsies. In this video, I'll explain what a heart biopsy is, why it's done, and then guide you step by step through the procedure so you know exactly what to expect. So, what is a heart biopsy? A heart biopsy is basically a procedure where doctors take a tiny sample of your heart tissue and examine it under a microscope. This helps them understand how your heart is doing on a really detailed cellular level, almost like zooming in to see what's happening inside your heart cells. There are many reasons why doctors might request a heart biopsy. It can be used to look for inflammation in the heart or to help diagnose certain heart conditions. But in people like me who've had a heart transplant, the main reason for a heart biopsy is to look for early signs of rejection. So the heart biopsy is therefore very crucial in making sure that any changes in your body are detected very early on so that your new heart is safe and protected. So, a little bit of background. I have had 11 biopsies. Yep, 11 biopsies. And all of them were done in the first 6 months post-transplant. It started off weekly, then every fortnight, then eventually every month, until I reached 6 months post-transplant. Let's talk about how a heart biopsy is actually done. You'll usually be asked not to eat or drink anything for a few hours before your biopsy. My biopsies would usually be 7:30 in the morning, so I would stop eating and drinking about 8 to 12 hours before. If I got thirsty throughout the night, I was allowed to take small sips of water. That's it. On the day of your biopsy, you'll be asked to change into a hospital gown, confirm your name and date of birth like 1 billion times, and finally, the team will check that you've signed the consent forms and whether you have any final questions about the risks or the procedure itself. When the doctor and their team are ready for you, you'll be taken into the procedure room and asked to lie flat on a table. Now, from my experience, the room is usually very, very, very cold. So, when a member of staff asks you if you'd like a blanket, remember to say yes, please. This blanket will be placed over your lower half just to keep it a bit warm, because obviously your upper half will have to be exposed for the procedure, usually up to here. They'll just sort of move your gown down like up to here, about your collarbones, so that they can access the neck. You'll then be asked to turn your head left, because most heart biopsies are done through a vein in the right side of your neck. You'll have to continue looking left for the rest of the procedure, which usually takes about 15 to 30 minutes. So just make sure you're in a comfortable position. The doctor will then clean the right side of your neck thoroughly. This part honestly feels like a spa day. It's so relaxing. This antiseptic liquid is usually orange in colour. That's why you often notice an orange stain when you clean the area afterwards. Once they've cleaned the area with antiseptic, they'll place a blue sterile drape over your neck and use an ultrasound probe to find a suitable neck in your vein. Vein in your neck. This vein will basically be the entry point to allow the doctor to pass the very fine tools that will basically go all the way to your heart and take little samples. Fun fact, if you've ever seen a vein and an artery on an ultrasound, you'll know they found a vein because veins basically collapse or squish when you press on it, whereas arteries don't collapse. Why? Because arteries have thicker walls than veins. Because arteries basically have to encounter very high pressures, whereas veins don't. Yeah. Biology. Once they've found a suitable vein, they will numb the area with a bit of local anaesthetic. Now, this is going to be the most uncomfortable part of the biopsy, but in my opinion, it is the most important because you won't experience any pain for the rest of the procedure and you can just chill with your head turned left and they can do the rest. So it basically just feels like a sharp scratch because they administer the local anaesthetic with a small needle, but it's very quick. And before you know it, the area will be numb and you won't feel anything for the rest of the procedure. Once everything is numb, the doctor will go ahead and make a tiny cut on your neck and insert a small tube into your vein. This is the tube that will keep your vein open so the vein doesn't shut. And the doctor will then be able to, in the next step, pass a catheter and a biotome through. The cut itself is very, very small. I don't know if you can see. Basically, so these are the areas. Now, very important, at this stage, you shouldn't be feeling any pain. You'll just feel a bit of pressure, like pulling and pushing and tugging. That's because of the local anaesthetic that you were given in the previous step. But if at any point you feel the need to go like anything that would indicate that you are in pain, you need to tell the doctor like ASAP. Raise your hand, move your hands about, do anything to get the doctor's attention, because all that means is that you might need a little bit more local anaesthetic to numb the area. Now that you've got an entry point in your neck, it's time for the X-ray team to set their machine up. X-ray guidance helps the doctors safely navigate your veins and your heart to then be able to take little samples. If they did it without an X-ray, it would basically be like a driver with a blindfold on. So even though you're getting a little bit of radiation from the X-rays, it is worth it because it's making the procedure more safe for you. The doctor will then use the X-ray to guide first a catheter and then a biotome through the vein in your neck all the way to the heart. So the catheter is a thin flexible tube that will essentially pave the way for the biotome, which I like to call the snippety thing, which is basically the actual instrument that is going to take little snippets of your heart tissue while it beats. Technology is insane. You can think of the catheter like a road that leads safely to the heart, and once that road is in place, then the car, which is the biotome, can be directed safely to its destination. Now, just a side note, you might notice the sound of the biotome as it passes through the catheter.
It basically sounds like...
This is completely normal and it's nothing to worry about. It's just the material that these tools are made of which gives them a particular louder or quieter sound. I just thought I'd mention it because everything is happening in very close proximity to your ear, so you might notice certain sounds and I don't want you to panic, basically. When they take small sections of your heart tissue using the biotome, you might hear the sound of the click when they take the sample, and at the same time you might feel your heart palpitate or flutter briefly. Again, this is very normal and it's usually over very quickly, and you're not going to feel any pain when they are taking those samples. Once the samples are taken, everything is removed and the doctor will apply a bit of pressure on your wound to make sure there's no bleeding and stick a bandage on. That is it. Heart biopsy done. Now for the best bit. You'll be asked to hang around for half an hour or so, having your blood pressure and heart rate monitored, and then you'll be given a lovely selection of the NHS's finest most healthiest of snacks. Also known as custard creams, bourbons and digestives. You're gaining weight. Have you been eating well? Make healthier food choices, they say, while shoving a box of biscuits in our faces after we've been fasting for 8 to 12 hours. And they blame us for gaining weight when they're the ones providing this to us after our procedures. Make it make sense. Once you've been given the "you can go" signal, you have to have more tests done, like a chest x-ray and an ECG. They're not going to let you go that quick. These are just routine checks to make sure everything looks good before you head home. The results of the biopsy usually take 12 to 48 hours. I would often get a call from the hospital to tell me if everything's okay. And that's the heart biopsy done. If you've had a heart biopsy and feel comfortable sharing your experiences, feel free to do so in the comments below. And if you're going to have a heart biopsy at some point, I hope this video has helped clear the air. Thank you so much for watching and take care.